Doing very well here, Neil, and you?
Great. And today's topic's the fourth trimester. What is the forgotten trimester?
Well, yes, it is. It's forgotten, unfortunately. So the first 3 months after birth is considered to be the fourth trimester, which is most often the forgotten trimester, postpartum.
What happens in postpartum in the fourth trimester?
Well, there are many things that happen then, and of course, around the country, if you're looking for global causes of trouble postpartum, you're looking at physical things like infection and bleeding to death and things like that. If you're looking at our country, our nation, you're really looking at mental health issues. So, yeah, there's a lot of things that happen, a lot of adjustments. Mom has to adjust, babies have to adjust, and dads have to adjust. And of course, if there's other children, they have to adjust. So lots of relationship stuff going on.
What is the most common cause of maternal mortality in the fourth trimester?
In our country, it is maternal mental health issues. And unfortunately, dads can have postpartum depression as well. And there is almost nothing on dad's postpartum depression. But, if you look at the group, if you listen to the CDC, it's 20%. One in five moms will have some kind of mental health issue after they deliver, and 75% of them will not get the treatment they need. And if you're looking at what comprises maternal mental health, it's suicide, homicide, and drug overdose, both intentional and unintentional.
How do we know these figures are correct?
Well, we don't. It's just a guess. The CDC makes guesses, approximations, they're called, but it's just a guess. And I don't actually even know how they I don't know how they come to their conclusions sometimes, because if people don't go in for medical care, how do they know they haven't gone in?
Why don't we have a better handle on postpartum depression?
Part of the problem is the way we try to diagnose it. We have this Edinburgh inventory, which is a screening tool for postpartum depression. And of course, it's mostly given postpartum, so not much in the prenatal course, and it's not given to dads, at least not very often. So you don't have anything that the test, the inventory screen doesn't predict and it doesn't avoid mental health issues.
What is the Edinburgh postnatal depression scale?
It's 10 questions. They each have 0 to 3 points. If you have 0 to 6, you're considered minimal or none. 7 to 13 is mild depression. Over 13 is considered depression, and that warrants an investigation. Again, this Edinburgh scale does not, it's not a diagnostic procedure. So these people, only if they're over 13, get referred for a diagnostic procedure.
That's very interesting. Uh, can dads get postpartum depression?
Yes, they can. They can have postpartum depression. It occurs later, about 6 months instead of 6 weeks. And yes, dads can get all of the problems. They can be suicidal and homicidal. So yeah, it's a real problem for dads too, but dads are really forgotten. You think it's bad for moms. It's much worse for dads.
Is there a screen for dads?
Unfortunately, no. If you're going to screen dads, you have to use mom's scale. And then the problem is dads don't have prenatal visits and they don't have postpartum visits either. So when are you going to give them the test?
What is the treatment for postpartum depression?
There are many treatments. Certainly, you'd start with what's called cognitive behavioral therapy or interpersonal therapy. And it's just talk therapy. So the patient talks and the provider is supposed to listen.
What are some common symptoms of PPD and common symptoms of PPD include?
Yeah, well, these are trouble bonding, doubting your parenting abilities, intrusive thoughts, and that is thoughts that won't go away, anger, irritability, somatic symptoms, aches, pains, headaches, cramps, thoughts of hurting your baby, and of course, you've got anxiety as well.
What are some of the antidepressant medications which can be used?
Common ones would include Zoloft, and that is probably your first choice because it has a low level in breast milk. The next one would be Prozac, and then of course you've got other ones like Pamelor, Wellbutrin, Remeron, and then you've got the new ones, Zulresso. That's really new, and that is IV, and it's every 60 hours. What we don't know is the cost. Then the other one that's been around a little longer is called Zurzuvae. That's an oral medication taken for 14 days. Again, these things probably run around $2,000. So, how you would find it, how you would pay for it, I'm sure that insurances won't pay for either one of these things. So, good luck.
All right, the best place to go is world.allen.com and purchase Pregnancy Your Way available today on Amazon. Thank you, Doc.
Thanks, Neil.
All right,